Hey, thank you so much for tuning into our channel. Dr. Kehinde Elisha speaking here. And don't forget, if you need some help to pass your board exam, we're here to help. We have 99.99% pass rate. www.npcertificationacademy.com. That's www.npcertificationacademy.com. You can also email us, nurse@gmail.com, or call 347-901-6037. To be very honest, on Wednesday and Thursdays, texts are preferred. All right. So now we're now going to quickly go on to meds to consider stopping before surgery. Now, this is not I yield on the exam. I am just doing this for experts are students that pass their board exam already. So we normally continue to educate them even after they pass their exams. So this is pretty much for a person that is practicing. It's not going to be on the exam. So which medications should you really stop? If you have a patient that is on psych meds and you don't know which one to stop. So the first one we're going to discuss is monoamine oxidase inhibitor. Monoamine oxidase inhibitor supposed to have a lot of drug-drug interaction in to start with. However, for surgery, we must stop it 2 weeks before. Why do we have to stop it 2 weeks before surgery? Hypertensive crisis risk, serotonin syndrome risk with anesthesia. Example, phenelzine, traniclopramine, selegiline. All right, we can call it PEETs or SPEETs, or there are so many mnemonics that you can have to kind of remember this. It's only 4 of them that are very, very popular. So don't forget, with monoamine oxidase inhibitor, we have the presynaptic and we have the postsynaptic neuron. Monoamine oxidase supposed to sit in the cytosol to break down the excess neurotransmitters. However, we have inhibited our function by adding I to it. Now, instead of breaking things down, it's going to build things up. So that makes it a very, very good drug, as a matter of fact, for what? Our patients with resistant depression. However, when you're doing surgery, you have to stop it 2 full weeks before surgery. What about stimulants? Got to hold on the day of surgery when it comes to stimulants, because, it's used for ADHD, patients. Why is that? Why do we have to hold it on the day of surgery? It's very simple. To start with, we are at risk for cardiac issues whenever we're on stimulant. And in fact, people on cardiac issues, we try to avoid it. So definitely we are holding it for risk of cardiovascular effect, arrhythmias, hypertension, and so on. What are the examples of stimulants? Methylphenidate, amphetamines. What about benzodiazepines? You want to consider tapering if long-term use. Risk: respiratory depression with anesthesia, withdrawal risk. Examples of benzos are alprazolam, lorazepam, clonazepam. Mostly the pams. Listen, you must know your drugs and your class. No mother or no kid without a mother. For every kid, there must be what? A mom. So for every drug, there's got to be a class. So make sure you know your drugs and class. So your benzo looks like plums and palms and all that. What about bupropion? You have to consider stopping it 24 to 48 hours before surgery. 24 to 48 hours before surgery. Why is that? It lowers seizure, can't pronounce this to save my life. Seizure threshold is lowered. Sorry for that. And of course, that means you're going to put the patient at risk for having seizures. So we don't want that happening on the operation table. So now, the next one is going to be lithium. You must hold lithium 24 to 48 hours before surgery. Why is that? Because of the risk for toxicity with fluid shift, right? We know there will be renal clearance changes. If we don't clear the renal system, it's going to pile up and create toxicity. And of course, don't forget, the lithium level is from 0.6 to 1.2 milliequivalent per liter. So we don't have a lot of room to go. We don't have a wiggle room. So toxicity is extremely common with lithium drug. Now, what medications do we typically continue, though? In summary, SSRI and SNRI generally continue unless, though, they have a high risk for bleeding. So guess what? They are going for surgery. I'm just going to stop it anyways. That is what? Fluoxetine, sertraline, venlafaxine. What are the risks? Increased bleeding, but withdrawal can worsen also with depression and anxiety after surgery. Because already we're suppressing them anyway, right? With all the anesthesia and stuff. What about atypical antipsychotic? Yeah, this can typically be continued especially quetiapine, olanzapine, aripiprazole. However, there may be some kind of withdrawal from dopamine or worsening psychosis post-op, so let's keep eye on that. What about mood stabilizers? Except for lithium, generally you can continue your mood stabilizers like lamotrigine, valproate, and of course, that ends my presentation. Speaking here is Dr. Kehinde Elisha, founder of MP Certification Academy. To reach us, nurse-to-nursecoach@gmail.com or visit www.npcertificationacademy.com. Like I said, this content is really not for students, it is for providers. So to further help my providers, you have to visit what? You can visit www.confidentprescriber.com. And I'm going to share that website with you right now. If you're practicing and you don't know where to go, you don't have no community resource, you have nobody to talk to, we are here to help. Listen, Dr. Kehinde Elisha have an experts group. It's called confidentprescriber.com. That is www.confidentprescriber.com. Listen, we get you to prescribe with confidence. We get you to prescribe without doubt. We teach you where to look, and we teach you what to watch for and all that. We have a beautiful community of nurse practitioners of over 1,000 people. Listen, what are you waiting for? You better come join us. So what packages do we have? A little quick overview. Onboarding accelerator program if you get a job, or you want that quick refresher course, and it's going to give you 20 CMEs. And of course, if you're just just want that community to just hang on for a year and learn every Thursday night, then we have the clinician's growth package. And that also attracts what? 20 CMEs. And of course, our schedule is right here for when they both meet. All right. Dr. Kehinde Elisha speaking here, founder of MP Certification Academy, 347-901-6037. We look forward to seeing you in our courses. We look forward to having you on our platform, or we look forward to seeing you in our free reviews like the one we're going to have on May 17th, 2025. Have a wonderful day. Bye-bye.